So just to launch into it, for those of you who don't know me, my name is Kirsten Sinclair and I'm a podiatrist. I've been a podiatrist for over 20 years. A brief kind of introduction to how I came to be the laser person within Celtic SMR. I actually purchased one of these lasers for my own clinic in 2019. And I would think at the time I was about the second or third podiatrist in the UK to purchase one of these lasers. And so I developed a really good relationship with Celtic SMR through their continued support, and also through by being able to help them in terms of being able to advise them on what types of pathologies I was seeing as a podiatrist, how I was using the laser, the types of results that I was getting. And that essentially has led to me now working full-time for Celtic SMR as their laser demonstrator. And I also offer ongoing clinical support for the people who have got lasers in their clinics. So a very brief introduction to me. So I am talking to you today about the use of MLS laser in lower limb pathologies. We're going to look at some really commonly seen pathologies within a clinical setting that affect the lower limb. We're going to look at the laser software. We're going to look at how we can pick settings and apply settings to our patients with our lasers. It's a very brief overview, kind of a beginner's guide. Like I say, if anybody has any questions, if you want anything a little bit more in depth, please feel free to ask your questions at the end. So first of all, why would we choose to use MLS lasers? There's other lasers on the market. What led me to choosing MLS laser? Firstly, the safety of it. So with MLS laser, we've got a range of different peak power outputs. We have got systems that deliver 25 watts, 75 watts, and 1000 watts peak power. The 1000 kilowatt laser is relatively new to the UK market, and we're kind of just introducing it towards the end of the year. If you happen to be going to Therapy Expo or the Royal College of Podiatry Conference, we will have those systems there. So please feel free to come past and have a look. Despite these high peak powers, you can use the MLS laser really safely. You are not going to burn your patient. I've used this laser, like I say, for over 4 years now, and hand on heart, I've never burnt a patient. I also, because I do demonstrations, I tend to laser myself at the same time, and I've never burnt myself either. So they are genuinely really safe to use. MLS stands for multi-wave locked system. And that's because we have got two different wavelengths that are delivered simultaneously in this locked, kind of synchronized manner. So we've got a 905 nanometer wavelength, which primarily targets the reduction of pain, has an analgesic effect. And we have got an 808 nanometer wavelength as well, which primarily looks at reducing inflammation and reducing edema. Sorry, that's me letting somebody in and pressing the wrong button. Let me go back. So the more powerful wavelength is the 905 nanometer wavelength. It's the one that's delivered at 25, 75 or 1000 watts peak power. So if anything was potentially going to be harmful for your patients, it would be that 905 nanometer. But that wavelength is delivered through a pulse diode, which means that that wavelength is on and then it's off, and it's on and then it's off. And in those off times, any thermal energy that would build up to dangerous levels within the tissues is given a chance to dissipate and to disperse more evenly through the tissues. So it's that keeps your patients safe, and it's that means you're not going to burn them. What that also gives you the ability to do, and we'll talk about this a little bit further on, is the ability to focus your laser on one spot. So you don't have to keep the MLS laser moving continuously. Again, we'll cover this later. There are some settings in which you do, and there are other settings in which you can use a point mode. So that I really liked about this laser, because it allows you to find these focal areas of pain, to find trigger points, and to focus your treatment on those points. Because you're delivering high peak power, it means that you can do quicker treatment times as well. So the settings within the device, generally for a trigger point on the presets, it takes 20 seconds up to 10 minutes for an anti-edema setting. We can adjust these times manually if we want to, but we can use these laser sessions. We can incorporate them into existing treatments, or we can do them as standalone treatments as well. You can also get a notable reduction in symptoms after just one session. I've literally been asked, is that a laser or is that a magic wand? And I love it when that happens. It's a laser, it's not a magic wand, but sometimes it feels a little bit like it is. So sorry, I'm still just letting people in. So you can do a treatment, and then oftentimes later on that day or into the next day, that patient is noticing an improvement, and it is really, really satisfying when that happens. I feel like as healthcare providers, we do what we do because we want to help people. The laser gives you a method of doing that really quickly. So when we're using laser, a lot of people say to me, what are we actually doing when we're using laser? What effect are we having within the body? How is it doing that? So the laser achieves 3 primary biological effects. We've got a photochemical effect, a photothermal effect, and a photomechanical effect. I'll explain these a little bit further. So the photochemical effect, one of the key target cells or chromophores within the body is cytochrome C oxidase. When the cytochrome C oxidase absorbs the light from our laser, what that does is it increases the production of ATP. So we've got more energy available at a cellular level. A really good way to remember that or to explain that to your patients is that laser is kind of the equivalent of giving your cells a can of Red Bull or an espresso coffee. It really helps to stimulate what's happening at a cellular level. It's encouraging them to do the things that we want them to do. We also have an effect on the pain perception threshold, so the patient doesn't feel pain as easily. And we also help to modulate the inflammatory response. We help to nip that inflammation in the bud. And I will explain those last 2 points a little bit further in a few slides' time. We also have this photothermal effect. So while the laser doesn't generate enough heat for it to be dangerous, there is a degree of warming that happens when we use the laser because we're passing photons through the tissues, and when molecules absorb those photons, it causes them to become excited and they warm up. And what that leads to is an increase in circulation in the area that we're treating, and therefore we get an increase in supply of oxygen and nutrients. We're also helping to flush through waste products, and we're helping to reduce the viscosity of fluids in that area too. I had been treating a friend who has sprained her ankle, so I'm not officially in clinical practice anymore. I am still registered, and I live in a small place. For those of you who don't know, I'm in the Orkney Islands, so I am kind of like back of beyond. But people know that I used to have a clinic, and they know that I have a laser. So I do get Facebook messages going, Kirsten, will you come in? Will you be able to laser my injury? So my friend had sprained her ankle playing netball, so I've been lasering her. And after every session, she told me it feels really warm in my ankle. She said the joint just feels like it's got a heat in there, it's got a warmth in there. And that is that thermal effect. It's just encouraging the circulation into that area. It's also really, it's that helps to relax your patients as well. If they feel that their muscle tension has reduced after treatment, that thermal effect is partially responsible for that. We also have a mechanical effect. So when you use laser with a pulsed emission, bearing in mind that our 905 nanometer wavelength is always nanopulsed, these pulses generate a non-destructive deformation of the cells. So this little video here is kind of explaining that better than I can with words. When that deformation happens, what we get is the encouraging of a production of extracellular matrix, protein synthesis, and cell growth and differentiation. So those are all really key components in tissue repair and regeneration. So using a laser with a pulsed emission is really important where we want to encourage a healing response within the body, which is all fine and good. But as I always say to people, what we actually really care the most about is what is laser actually achieving? What's it doing for our patients? So there are 4 key systemic effects, and those are the reduction of pain, the reduction of inflammation, the reduction of swelling, and encouraging tissue regeneration. I also like to point out as well, I know we've got a lot of podiatrists in the room today. And if you're anything like me, when you think about tissue regeneration, you think about a wound, you want to heal a wound, but this also would cover things like ligament damage, plantar plate tears, neuropathies as well, where we've got nerve damage and we want to encourage nerve regeneration. Tissue regeneration covers all of these. It's not just your open wounds. So just to point that out, you're maybe not all as bad as me though. The analgesic effect, so that's achieved because the laser induces neural inhibition in the peripheral nerves. It slows down the speed of neural transmissions and it decreases the amplitude of the action potential. So an easy way to remember that or to explain that is that laser helps to slow down the speed of the pain messages in the nerves from the area that hurts up to the brain. And when that message arrives, it doesn't shout as loudly as it would have done had you not used the laser. And then, as we've already mentioned, laser is helping to encourage vasodilation in the tissues. Laser also has an effect on nitrous oxide, which is a powerful vasodilator. So we're, again, helping to improve circulation through the area that we're treating. We're getting oxygen into hypoxic tissues. We're removing those waste products. We're helping muscles to relax and movement to be restored. You can take advantage of that by encouraging your patient to go and do their rehab. You know, if you've got a patient who needs to do exercises, but they don't want to do them because they're uncomfortable or they're concerned that they're going to make their pain worse, then if they feel a little bit better after having a laser session, encourage them to go and do their exercises. A really nice example of this is a patient that I saw earlier on this year who'd had an Achilles rupture. She ruptured her Achilles 9 weeks before I saw her. She'd previously, I think 2 years previously, had ruptured the other side. So she knew what the recovery was, what it looked like for a ruptured Achilles. And this is a grade 3 rupture. So she was in a boot for 8 weeks. And when she came out of that boot, she found that she couldn't get her heel to the ground, which was very different than her previous experience. She couldn't get her heel to the ground, and she said she felt it was really pulling hard on the Achilles insertion. She also had a huge lump in the back of her leg, in her calf muscles. What had happened was when she'd ruptured her Achilles, she'd also had a significant tear of her soleus. And while being in the boot had allowed her Achilles to knit together and heal, it had caused that soleus tear to heal in just this solid mass. She didn't really have any flexibility or movement through that. So she's asking me, will laser help me with this? And I was like, I don't know. It's not something that I've treated before with the laser, but laser has no recognized harmful side effects. So ultimately, you're not going to harm your patient. You're not going to make them worse. So I said, let's give it a go. Let's see what happens. So she came out to me. The first time she came out, she was driven out to me because she still couldn't drive, and she came out of the car on a crutch. She came in and I did the laser session for her. And before she got off the bed, she was like, look at the movement I've got through my ankle. And she had much more dorsiflexion immediately following that laser treatment. And you could visualize that the mass, the swelling on the back of her leg had reduced. So she went off. I saw her again 3 days later. And she took advantage in the middle of that, in between those 2 appointments, to do some exercises. So she was doing yoga, was her thing. So she was stretching out the tissues in the back of her leg between our treatment sessions. And when she came out for her second appointment, she drove herself out and she came out of the car with no crutch. She wasn't, skipping into the house. She was still limping, but it had made a huge difference to her in just a few days. And that was allowing her to take back some control and to do some exercises at home as well. So just a really nice example of how the laser can do that. We ended up, so this is a question I always ask, we did 5 sessions for her. So we did 5 sessions in a row. Kind of after the initial 2 in 1 week, we did them once a week, and then she went on a hen do and she ended up coming back for a top-up session after that hen do, but she's back running, cycling, doing all her normal activities again now, which is a great outcome. Okay, moving on. We also have this anti-inflammatory effects. There are lots of rabbit holes that you can go down in terms of the molecular and cellular effects of laser. I'm going to keep it fairly simple for the sake of this webinar. Ultimately, what using laser does is it reduces the presence of pro-inflammatory molecules. There was a study done using the MLS laser that demonstrated that using the laser causes an overexpression of a protein called NLRP10. NLRP10 inhibits caspase 1, which is an enzyme that's responsible for converting pro-interleukin-1 beta into interleukin-1 beta. And that interleukin-1 beta is a very pro-inflammatory molecule. It really sends out inflammatory signals and encourages other inflammatory factors to come into the, I'll say, the inflammatory party, the inflammation party. So by increasing NLRP10, we're actually reducing the presence of interleukin-1 beta, which is helping to nip that inflammatory response in the blood. Again, that vasodilatory effect, encouraging blood flow through the area, means that we're actually helping to wash out those pro-inflammatory molecules as well. For reducing swelling, laser is amazing for reducing swelling, particularly where it's associated with inflammation or trauma, because by reducing inflammation, we're also reducing the process that's responsible for encouraging the production of that fluid in the first place. Laser's been shown to stimulate the lymphatic system, encourage lymphatic flow. And again, when you use a laser with a pulsed emission, these pulses cause a kind of a wave effect in the tissues, and that helps to flush fluid through from the area that you're treating. Encouraging the circulation through, again, helping to move fluid through. And then with your handpiece, which you'll see in one of the slides that are coming up, with your handpiece, you're actually in contact with the tissue, so you can actually help to physically push the fluid through from that area as well. So you can often notice the difference. The number of times that I've kicked myself for not taking a before photo on when I've been treating an area of swelling, it can make a huge difference. One patient who came into me had knee arthritis, and the actual pain and stiffness wasn't bothering her too much, but she did have swelling associated with that, and it was that was bothering her. She really wanted me to help her get rid of her fat knee, as she called it. So again, I didn't promise her anything, but I said we can give it a go. And we did one session with the laser, and after one session, the circumference of her knee had reduced by ½ an inch. So she was delighted. That was a significant improvement for her. Tissue regeneration, again, improving circulation means we're getting more tissue perfusion. There's more oxygen available at a cellular level. Laser has been shown to improve the proliferation of myofibroblasts, and it also helps to modulate collagen production. So wounds that are treated with laser tend to heal more quickly, and if there's any scar tissue that's going to be left behind, it's of a better quality in that there's less of it, and it tends to be more flexible because the laser helps with the laydown of type 1 collagen. So we've got a better quality of collagen laid down. We have got lots of podiatrists using laser in their post-nail surgery care packages. And every single person who reports back to me about their, if they've done an audit, or if I just ask them, are you finding that it's speeding up your healing times? 2 weeks is kind of on average how much more quickly patients are healing after their nail surgery when laser is used versus when laser is not used. Excuse me. There are lots of indications for using your laser. I tend to say to people, if it ends in itis, then you can probably use your laser on it. Laser, as we've mentioned, is an anti-inflammatory treatment modality. So if you've got a pathology which is inflammatory in nature, it makes sense that you can use laser to treat that. So things like arthritis, bursitis, excuse me, plantar fasciitis, tendinitis, you can use laser on all of these. With things like arthritis, you've obviously got a more chronic degenerative pathology there. So what we can't do, unfortunately, is cure that. We can't fix arthritis, but what we could potentially do is help to reduce their pain, increase their range of and quality of movement, which in turn really helps to improve their quality of life. So it's things like we've got Sue Paris with us today, who gave me a lovely case example of a patient that she'd been treating who had arthritis in his hands. So as podiatrists, we can treat hands as well. And she had treated this patient for his hand arthritis. This man was a carer for his wife. And one of my favourite stories that I've heard was that he found himself at the top of the stairs one day, taking a cup of tea up to her. And he discovered that he was actually able to take a cup of tea in each hand, which he hadn't been able to do for a number of years because he just didn't have the grip strength for it. But after having laser therapy, he was actually able to simple things like taking 2 cups of tea instead of having to do one at a time. One of my patients who had knee arthritis and we treated, she said that she could, if she needed to pick something up off the floor, she could just kind of bend down and pick it up instead of having to think about how she was going to get down there and then how she was going to get back up again. So for these patients, that is a big improvement in their quality of life. Ulcers and wounds as well. So as I've mentioned, we can use laser on wounds, and then also neuropathies as well. So we can use this on lots of different types of neuropathy, whether that be diabetic, whether that be impingement. But the caveat to that is that if your patient has got a neuropathy, if we use the example of a diabetic patient with neuropathy, that has been caused because their blood sugar levels have been unstable. So we need to make sure that their blood sugar levels are stabilized again and at a manageable, healthy level for that patient. Otherwise, we're kind of going to be taking one step forward and one step back. Neuropathies are impingement neuropathies are the same. If the impingement is caused by inflammation, then it makes sense that we could use the laser to help reduce that inflammation and kind of get the patient out of that catch-22. But if it's an impingement neuropathy because of a biomechanical cause, something biomechanical feeding into that, then that needs to be addressed. Or again, we're going to use the laser, but that biomechanical issue is still there. So as soon as they go back out and do the things that caused that impingement in the first place, then it's still going to be there. So overall, laser is part of your treatment plan. It's not the treatment plan. We still need to put in place the other things that we want to, that we would normally put in place, whether that be orthotics, taping, exercises, etc. Laser is used to complement these things, in that you're going to reduce your patient's pain and you're also going to increase their speed of healing. So it forms part of what I also kind of refer to as a layered treatment plan. You're throwing everything at this that you can. So talk a little bit more about integration and how you're going to include this in your practice. When I did my training 4+ years ago, I was told that in an ideal world, you would do this 3-2-1 treatment protocol, where you do 3 treatments the first week, 2 treatments the second week, and 1 treatment in your last week. And as soon as I heard that, I was like, there's no way that I can do that. My diary is chocker. I can't see people 3 times a week. And while my patients want to get better, they're not always willing or able to come in multiple times a week. So with the MLS lasers, you get a 4-week free trial period to make sure that you like it, to make sure that you can integrate it into your practice, that you're getting the results that you'd hope from it, which is exactly how I started as well. So I said, I'm going to do 1 treatment a week for the 4-week trial period. And if I can't get good results after that, just doing it once a week, then basically I can't buy your laser. Obviously, the fact that I'm here just now, sorry, can I just ask everybody to make sure that their microphones are muted? I'm just hearing a wee bit of noise coming through. Thank you. So yeah, so I said I'm going to do once a week treatments and see what the feedback is. If it's good feedback and I can work it that way, then job's a good in, I'm going for it. So I obviously did get good feedback, and I think that is the beauty of laser as well, is that you can kind of make it work for you. You can make it work for your patients. I know of some people who are working with really elite level sports people, and those elite level sports people need to be better yesterday, and they have got the time and the inclination and the ability to come in 5 days a week if they need to get them better faster. But that doesn't work for most people. So you can make that work for you and for your patients. But I would say a minimum of once weekly. And the reason for that is that laser has a cumulative effect. So each treatment that you do builds upon the effects of the last. Generally, I recommend 3 to 6 sessions. That sets your patient's expectations around the right mark. And I would say 3 is a minimum. Oftentimes, like I mentioned earlier, people will feel better after 1 session and then they go, it's all right, I don't need any more. I feel great, I don't need any more. But nothing is fixed after 1 treatment. Generally, there's a process that's underway and they're feeling better, but they're not there yet. So 3 is a minimum. And if they say, but why do I need that? Because I'm feeling better. Then what you can use as an analogy is like antibiotics. You take a course of antibiotics for an infection and you hope that you start to feel better before you're finished that course. But you have to complete that course because you want the best long-term outcome. So 3 treatments as a minimum. And as a rough guide, and it's absolutely not set in stone, acute pathologies tend to respond more quickly and need, maybe just the 3 sessions, whereas chronic pathologies take a little bit longer and might need up to 6 or maybe more sessions. But saying 3 to 6 helps your patients to recognize how many they're potentially going to need. The settings in the laser can be used on their own. So if you just want to pick one setting, and I'll explain what these are in subsequent slides, and use that as part of your treatment at the time, then you can do that. Or you can use the individual settings in combination with each other. So I like to use laser as a standalone treatment. So I get appointments where patients are coming in only for laser treatment. And in that situation, I want patients to feel like it's worth their while coming in. And because they're normally only coming in once a week, then I want to do a nice thorough treatment and make sure that I'm doing everything that I can. So I tend to use, depending on the settings that I'm picking, I tend to use 2 or 3 settings from the laser within that session. And my appointment times are 30 minutes. And within those 30 minutes, I'm usually doing 15 to 20 minutes of lasering. So I'll talk you through what that protocol looks like as we go through this. And then just to reiterate that laser is part of the overall treatment plan. It's not the treatment plan on its own. So this next slide shows you what the MLS software, this is your home screen. So you've got, on your home screen, you've got 2 anatomical figures. And then at the right-hand side, at the top, you've got a tab that says Setup. Setup literally refers to the way that the machine is set up. You can change the time and date in there. You can change the noises that the machine makes, but otherwise everything in there is kind of perfect as it is. You don't really need to change anything in there. It's all good. Underneath Setup, you've got Personal. It's not a tab that I have really used that much, but it allows you to enter up to 15 of your own preferred treatment programs. So if none of the presets in here are hitting the mark, or you've got a certain combination that you just like to go to, we also have some chiropractors, osteopaths who may do both human and animal treatments. And so if they've got one of these human based MLS lasers, they can enter up to 15 of the animal-based settings in there. So they can essentially use one laser to cover both their human and animal patients. But that's what your Personal tab is. Then you've got your anti-edema, which is quite self-explanatory. We'll look at that a little bit further on too. But that is the setting that you're going to pick when you want to treat swelling. And then underneath anti-edema, you have got biostimulating. And biostimulating is a really good option for when you want to encourage a healing response. So you can use that for wounds, you can use that for neuropathies, you can use that for ligament damage, etc. So you've got that too. So across these 2 different anatomical figures, you have got boxes across different areas of the body. Within each of these boxes is a list of pathologies that relates to that particular body part. I will point out that just because a specific pathology falls in a certain box doesn't mean that you can only use it within that box. A brief example of that is that in the shoulder box here, we've got a bursitis setting. You can take that bursitis setting and you can use that anywhere in the body. So you can use that for a hip, you can use that for a knee, you can use that for a retrocalcaneal bursitis. At the end of the day, an inflamed bursa is what it is. It doesn't matter if it's in the shoulder or if it's in the hip, it's the same pathology. So that's a very quick guide to your home screen. So moving on. When you select a particular body part, so we're focusing on the lower limb here, so we're in the box around the foot, you've got a list of pathologies in a box in the top left-hand corner. You can also choose scan phase or trigger points, which we'll look at very soon. When we choose scan phase or trigger points, you can choose from acute or chronic pain, and there are a couple of other settings that we can look at as well. So you're entering in your patient details here, and then you have got your parameters down at the bottom. Your parameters are always preset. They're all at 0 at the moment because none of these pathologies or scan or trigger has been selected. When you select any of these, the preset settings instantly populate the parameter settings at the bottom. So that's all there for you. So have a little look further at that just now. So the scan phase, now I'm going to talk you through kind of my standard once a week treatment protocol for common pathologies like tendinopathies, plantar fasciitis, bursitis, etc. Generally, I like to start with the scan phase. I describe that as the laser equivalent of effleurage. If you ever have gone for massage yourself, or if you do soft tissue work yourself, you know that you don't go into the massage therapist and go, oh, this bit really hurts, and then they just get stuck right into that bit. They tend to be a bit kinder than that, and they do a little bit of almost like a warm-up first, the bigger, more sweeping movements. That's what we do with the scan phase. It's known as a global approach. So we're not necessarily just treating the area that hurts, but we're treating the bits that feed into that area as well. So you'll see that coming up very soon. It's a really good starting point for your treatment. It helps to relax the tissues that are feeding into the area that hurts. I am going to talk in the following slides a little bit about the multi-diode applicator, or the Charlie head. So hopefully, I know that I'm probably quite small on your screen just now, but you can see behind me that I've got a laser here at the back of the room, and attached to that is a multi-diode applicator, which is affectionately known for unknown reasons as a Charlie head. So you can use the Charlie head at the same time as you use your handpiece, or you can use it individually to allow you to do completely hands-free treatments. With your Charlie head, you get to select only the pathology settings. There's no scan phase and there's no trigger points. There is an option in another area of the body for muscle contraction. So you can kind of get past the fact that there's no scan phase by using the muscle contraction with the multi-diode applicator. And that would allow you to do that on one area or one limb. And then you can use the handpiece on the other with the scan phase. So you're kind of doing a bilateral treatment that way. So just to show you how this works, you can select scan phase, you can choose from acute or chronic pain, and then that opens up at the right-hand side of your screen options for size and phototype. So this is your patient details. Size, small, medium, or large. This refers more to the BMI of your patients. And then most people are medium. And then you can also choose phototype, which is the skin type of your patient. So we treat people with a higher melanin content more gently than we can treat people with a lighter skin type. Because of the melanin content, melanin grabs light as it passes through the tissues. So we need to generally drop our energy down a little bit. So we can select from phototype A and phototype B, depending on the skin type of our patient. Then we press start and we are ready to go. So moving on to the next slide. This is how we're going to do a scan for plantar fasciitis. So I'll just let my video self explain this to you. So bearing in mind that with the scan phase, we're doing the global approach. We're treating the areas that are feeding into the pathology. So to treat a plantar fasciitis, we're going to treat the actual plantar fascia, so the sole of the foot itself, all of the bits that are feeding in to that problem. And you do that. And then what you can do also is scan the muscles of the posterior calf. So there's research that suggests that over 80% of cases of heel pain have got some involvement of the gastric. There's contraction in the gastric. So it makes sense that you'd want to scan the posterior leg as well as the plantar heel. So my approach to this would be to do the plantar aspect of the foot first, and then to do the posterior aspect of the leg. So you're dividing that into two different sections. So perfect. And now just to demonstrate the scan phase of an Achilles. Okay, so to scan an Achilles problem, we're going to scan the Achilles tendon itself and also all the muscles of the posterior calf. We're just going to keep going until the time has completed. You can also section this, so you could just do the lateral gastric head, followed by medial gastric head, followed by the more distal portion of the muscle and the tendon. You can also go perpendicular to change the angle that you're delivering the light. So just to point out there as well, the laser is always applied at a 90-degree angle to the surface that you want to treat, and that just avoids any reflection of the light off of the tissue. So makes sure that you're getting a more thorough treatment. And now just to cover a knee, just to make sure you're seeing this being used across different parts of the body. To treat a knee pathology, like a knee arthritis, we're going to scan around the area first. So we're going to scan up into the quads. I'm limited by what I can do here because of the shorts that this patient has got on.
but you're just going to scan around that whole general area, whichever muscles are feeding into where the pathology is. If you're talking about a knee arthritis, I would recommend just doing a general scan of the quads and all the muscles that are feeding into the knee.
So once I've done my scan phase and I've covered, I'm just going to move this on a little bit because that black screen distracts me. So once I've done my scan phase, then I'm going to move on to targeting trigger points. Some of you will be familiar with trigger points, some maybe not so much. Trigger points are focal areas of pain within the muscle that are feeding into the bit that hurts. So they tend to be more proximal. With an Achilles tendinopathy or a plantar fasciitis, these trigger points will be in the calf muscles and most normally in the gastric heads. You can find them by palpating them, just feeling for them. Your patient will know when you've hit them. It's a special kind of pain. Tend to feel a little lump or sometimes a little dip. And when you press it, generally it's quite a high pain score. Normally at least a 6 out of 10. If it's not, it's probably not a trigger point. And they tend to radiate pain distally. Another, so you get a guide on the laser that shows you where it suggests trigger points might be. All of these are just guides. It's not necessarily the patient that's in front of you. So I tend to take the images on the screen as very much a general guide. But I also recommend this book. So it's Trigger Point Therapy for Myofascial Pain. And that's written by Donna and Stephen Fernando. And you can get this on Amazon for less than £20. And it's a really good buy. It shows you areas of referred pain and the trigger points that that referred pain can come from. So if you're interested in that, then I would really recommend that book. So trigger points, I'll just show you on the software how you can select those. So you can choose the trigger point. Again, you can choose from acute or chronic pain. The laser adjusts the settings according to which one you pick. And then, as with all the other settings, you just press the start button and then you're ready to go. So there is not a Charlie head equivalent with your multi-diode applicator. The Charlie head covers a 20 centimeter diameter area, and that's just too big for trigger points. So you can only do trigger points with your handpiece to help you really target those small spots. So the next slide is going to show you how you would approach the treatment of trigger points with the laser. The next slide.
To treat trigger points, first of all, you need to find the trigger point on your patient. So I've done a little bit of poking about already. We found a trigger point here, got a pain score of 6 out of 10. So what you're going to do is put your laser directly on that trigger point, trigger the laser, and we just hold it there. It's 20 seconds for a trigger point on the presets. So we're just going to keep it there for those 20 seconds. And bearing in mind that other class 4 lasers, you can't hold them still in one point because they'll generate heat within the tissues and you could potentially burn your patient. But with the MLS one, you're not going to do that. So that trigger point is finished. What you would do is palpate that same trigger point again, ask for a repeat pain score. What's your pain score now? 4. So I would like that to be a little bit less. So what you can do is go back on and repeat that same trigger point up to 3 times. What you're aiming for here is a 50 to 70% reduction in pain on palpation of these trigger points.
You have to excuse my very bored assistant there. So once I've done my scan phase, and then I've completed my trigger points, the next thing that I want to do is choose the specific pathology that I want to treat. And this is what formulates my once a week treatment plan. Scan phase, trigger points, and then whatever pathology setting I want to choose. So if I have a patient with a plantar fasciitis, I may well want to choose the plantar fasciitis option because we do have a specific plantar fasciitis option on the laser. So we choose the box around the feet, and then we can select plantar fasciitis from that list. We can adjust the area. So again, it's 100 square centimeters, which is roughly palm size, 10 centimeters by 10 centimeters. So you can adjust that down. That will adjust the time to suit the area that you've chosen. And then you're just going to keep the laser moving. So I'm going to show you that in the next slide. And I'm also going to explain why sometimes the Achilles setting is actually a better option for plantar fasciitis.
When you choose the plantar fasciitis setting, to treat the targeted pathology, it comes up with an area. So 100 square centimetres is the area that you can then adjust to suit the size of the actual area you want to treat. So assuming a plantar fasciitis is presenting as a plantar heel pain, what you would do with that setting is just keep the head of your laser moving back and forth across the specific area where your patient is feeling their pain. So I would just keep doing this for the full time that the laser gave me, focusing the treatment on that plantar heel area. Which is fine if your patient has a really diffuse plantar heel pain, but in my experience, most patients with plantar fasciitis have actually got a focal area of pain around the area of the insertion on the calcaneum. So most of them find it particularly painful around here. In which case, using a setting that means that I keep the laser moving over a wider area doesn't necessarily offer the best approach. And what I might want to use instead is the Achilles tendinitis setting.
Just explain that in the next slide. So the Achilles tendinitis setting differs to the plantar fasciitis, because when I choose the Achilles tendinitis setting, you'll see that rather than an area, it says 6 points. The laser's giving me 6 suggested points, but as I've said already, you don't have to use the suggested points. You can work with your patient's actual area of pain. So I'm going to explain that in the next slide.
The Achilles tendinitis setting allows us to treat using certain points. So if I was treating an actual Achilles tendinitis, what I would do is find the patient's focal area of pain or get the patient to point out that focal area of pain to me. What you do then is you put the laser directly on to the point that you want to treat. And again, like the trigger points, you hold it in that one spot for a predetermined length of time. So on the settings that I'm using at the moment, the total treatment time is 7 minutes and we've got 6 points, which means that each point is 1 minute and 10 seconds long. So I'm going to keep my laser on this one point for the first minute and 10 seconds. When that's finished, the laser is going to beep at me. The handpiece is going to switch itself off, so I know that that first point is done. I don't have to keep an eye on what's happening. When that first point is finished, what I'm going to do is move that laser on to the next point that I want to treat. As a general guide, I say to people, you can think about that first point that you're treating as the centre of a compass. You can then do a point to the north, point to the south, and then one to the east and one to the west, depending on how you want to work it. And then if I'm using this for plantar fascia, what I would do is very similar, find the focal area of pain, put my laser on that focal area and treat that point. And then just work around that too. But again, be guided by the patient in front of you. If your patient's pain is all to the lateral side and it makes sense to you to use all your points laterally, that's absolutely fine. You can do that. If you want to use all your points to the medial side, because that's where their pain lies, that's fine as well. I always say this, and I'll say it again, treat the patient in front of you. They're an individual. You do have a guide on the laser itself if you're not sure where to use your points, but that is just a guide. So that's my first point finished now. I've just let that run down and the laser has switched itself off. So all I would do now is move on to the next point I want to treat, trigger and repeat.
I think I got my east and west mixed up there. So moving swiftly on. So just to cover how we can treat arthritis now, we're looking at a knee treatment. Oh, sorry, we're going to look at the software first. So you can use, there is actually specific arthritis settings within the laser, in the feet, in the hands, and also around the area of the back. There's a knee pain setting in the knee, in the box around the knee, which I quite like to use to treat knee arthritis as well. Optical windows are important. I'll cover that in the next couple of slides. Also to point out that in very chronic pathologies, we may well want to increase the dosage that we're delivering. Generally, chronic pathologies respond better to higher frequencies, higher intensities, and higher dosages. So your dosage is your joules or your joules per square centimetre. So if you did want to trial a laser, then you get full training. We make sure that you're happy with all of this. And as I've mentioned, you've always got access to me as ongoing support. So we make sure that you're comfortable, that you know what you're doing with the laser in terms of using the presets, but also to take things away from that and use it a little bit more manually. So now we're going to look at the knee.
A question that often comes up is how to treat the knee. So I've got a knee pain setting selected here, which is a point-space setting. What I tend to do is 4 points from the front. So we're doing 1, 2 above, and then 1, 2 below. It's important to remember optical windows because the laser light doesn't penetrate through bone, so we have to work around the kneecap. What you can do is just pop the kneecap slightly to the side, get your laser in under there and trigger it. And again, we're using a point-space system, so we're going to keep the laser here for that predetermined length of time. When it's finished, the handpiece will switch itself off, and then we can move on to the next point that we want to treat. And repeat. And then I would get my patient to lie on their side or on their front and do 2 points from the posterior aspect of the knee as well.
And just to point out, I've got a cushion under the knee there because that just flexes it slightly, relaxes and extends it so that we can get the light in there more effectively. An optical window is a space that you open up in a joint to allow you to treat it as effectively as possible. So we'll see that in the first MTP in the next video.
To treat the first MTP or any joint with arthritis or any joint space that we want to get into, we need to be able to get the light into that joint as effectively as possible. With our first MTP, we've obviously got quite a neat joint space here. And if we just put the laser on as is, we're not going to get the best amount of light into that joint. We need to irradiate as much of the actual joint surface as we can. So what we need to do is open up what we call an optical window. So what I tend to do is plantar flex the toe, which opens up that dorsal joint space. You can feel it there. And then you can put your laser on top of that joint space and then treat from there. So this point's going to last for a certain length of time. Once it's finished, the laser will stop itself. I'm just going to stop it now to save time. And then what we can do is dorsiflex the toe, which opens up that plantar joint space. Again, you can feel that. And then you put the laser on the plantar aspect of the joint and you treat that way. And you can treat more than one point. It depends on the size of the joint that you're actually treating. So that first time is finished, so you can just move the laser on slightly and then treat slightly further around the joint or from a different angle, and just repeat that as many times as you need to till you've covered all of the parts of the joint that you want to cover.
It's my patient with his artificial wound for the wound section, not the next section. So to cover edema now, I'm just going to move on this swiftly. I'm aware that our time's coming in and I want to cover everything for you. So there is, as I mentioned earlier, we've got the actual anti-edema setting on the laser, which you can select. So when you go into that, you can adjust the area that you want to treat. All your parameters are there. You've got your phototype again. You just press your start button and you're ready to go.
For edema treatments, these are the only, or this is the only setting in the laser that you're going to use the handpiece in a circular movement. So if we've got, just say we've got some edema around the bottom of the leg here, one option is to just do circular movements around that area. So we're kind of taking advantage of the thermal and the mechanical effect of the laser here to encourage blood flow through the area and to reduce the viscosity of fluids. And then what I like to do is just kind of periodically sweep up towards the nearest proximal lymph node. So we're using the handpiece of the laser like a bit of a massage tool. So we're getting all the benefits of the light, but also the actual physical contact of the handpiece as well. Another approach would be if you've got a very swollen lower limb and you don't really have anywhere to move the fluid from this area into, if you're moving fluid into fluid, what you can do is start at the nearest proximal lymph nodes. So in this situation, we're going to be starting from the posterior knee, and we're going to work down towards the area of the swelling. So what we're doing is creating a channel, if you like, from the lymph nodes. I'm doing this a bit faster than I would do it in an actual clinical situation. And then I would work around the area of the fluid, and then I'm going to push that back up that channel or work that back up that channel, moving it along the pathway that I've created back up to the lymph nodes where the lymph nodes can deal with it.
You've also got the option of doing the anti-edema setting on the multi-diode applicator as well, which allows you to do a hands-free treatment. So looking at wounds now, you can select on the laser. We've got option for wounds and also ulcers. Ultimately, they're all the same. They've got different names to make them more intuitive, but you can choose whichever you want to treat, and your biostimulating setting that's on your home screen is the same thing as well. So again, you just adjust the area and then you can carry on with your treatment. And I'm going to cover how to do that in the next video. This is using the handpiece.
So this patient has a terrible wound on the dorsum of their foot, which we want to treat with the laser. To treat wounds, we recommend cleaning the wound as effectively as you can first to get rid of any exudate, any dressing residue, etc. And then you can cover the wound with a clear film dressing or the head of the laser with something like cling film. And in that way, you can actually contract the wound to treat. If you don't have the time or the inclination to do that, what you can do is just hover. So I'm kind of going at a funny angle here just so I don't block what I'm doing, but you're working roughly 5 millimeters, so half a centimetre above the surface of the wound, and you just keep going again until the time is completed. On your device, you adjust the area to suit the size of the wound that you're treating. Generally, we recommend sizing up. So for a smaller wound, we'd recommend adding on an extra 3 centimetres around the edge of the wound to your size. For a larger wound, an extra 5 centimetres. And the reason for that is that we're going to treat the periphery of the wound as well as the actual wound itself.
And the next slide, just to cover the treatment of wounds with the Charlie heads.
Charlie head also offers a really good option for treating wounds because it's designed to be used at a distance of 20 centimetres. There's no issue with contacting the wound. So you position the Charlie head so the wound is in the central treatment area, trigger, and then you just leave the Charlie head to complete its time. We've adjusted the area prior to starting this. So this is just going to take a few minutes to complete. Once you've finished treating wounds, whether with the Charlie head or the handpiece, just need to put a nice absorbent dressing on afterwards because we've stimulated cellular activity. So they can get a little bit weepy after treatment. That's normal and that's fine, but just a nice absorbent dressing on afterwards. Treat these kind of a minimum of once a week, ideally twice a week if you can. Treatment times are short, so it's not massively time consuming, and we recommend just keeping on going until that wound is healed.
So just to recap all that for you, the primary functions of laser are to reduce pain, reduce inflammation, reduce swelling, and to encourage a healing response within your patient's body. You can use the handpiece and the multi-diode applicator together or individually. Recommend treatment as minimum of once a week, and you can generally set expectations at 3 to 6 sessions. We can choose from a scan phase, trigger points, and pathology settings. We can use those in combination or on their own. You've also got your anti-edema setting and you've got your biostimulating setting. And there's a huge range of indications for use of the laser, from MSK pathologies to wounds to neuropathies. And you can use laser on both acute and chronic pathologies as well. We are going to be at... Oh, there we are. We're going to be at the Royal College of Podiatry conference in November, where, as I mentioned earlier, we're going to have our MIS, our new 1 kilowatt peak power laser with specific settings for neuropathies. It's crossover between our MLS lasers and ASA's really high level lasers, the Helterapia and high intensity laser therapies. We're also going to be at Therapy Expo. So if anybody is going along to Therapy Expo, again, we're going to have a MIS at that as well. At Therapy Expo, we're doing workshops for diagnostic ultrasound scanning. And if you come and see us at the Royal College of Podiatry, you could potentially win an iPad. So if anybody would like more information about lasers, if you've got any questions at all, I'm seeing there's some questions in the chat there. I'm aware that we've come to time, so people are going to have to pop off. You can contact us, sales at Celtic SMR, for general inquiries. If you have a clinical question, feel free to drop me a message, ksinclair@celticsmr.co.uk. We've got our website and our phone number there as well. Really friendly bunch of people. Feel free to get in touch and ask any questions at all. Like I mentioned, we do 4-week free trials, so you can get the laser in your clinic, get a feel for it. You get full support for all the time that you have the laser, and if you do want to keep it, full support afterwards too. I'm just going to stop sharing and have a spy at my chat box. I've seen some questions in there. I can get it to open up. Can you overdo it? Not really. You can overdo it in the sense the only negative side effect that people can get from the laser is something called a rebound effect. So I use the analogy of Red Bull or an espresso coffee as how the laser stimulates the cells. So most people can have a can of Red Bull and an espresso and they're fine, but some people will have that and they'll be bouncing off the walls. They're kind of overstimulated. And for some people, laser does that to their cells. So they get this bit of a rebound effect where they actually get a temporary increase in their pain and inflammation. So that can cause that to feel a little worse for 24 to 48 hours, but almost always they feel much better afterwards once that has eased off. So you can overdo it in the terms that some patients, and they are very much the minority, can get this little bit of a rebound effect, but otherwise you can't overdo it. You're not going to cause any harm, not with the MLS laser anyway. Are there any current NICE guidelines for laser therapy? So laser therapy is in the NICE guidelines for the treatment of oral mucositis, but as yet there's nothing in there that advocates it for the use of any MSK pathologies. I have had people, including myself, who've used laser for the treatment of patients and just put it in under a more general heading, just a podiatry treatment, etc. And we've got it through that way. But the honest answer to that is there's nothing within the NICE guidelines at the moment for the use of laser in MSK pathologies. Patients awaken symptoms. There's other people got to run. So thank you very much. That's taken us right up to bang on 2 o'clock. If anybody has any further questions, please do shout. The average power, the MLS, it depends which device you're using, up to 3.3 watts. Or up to 6, I think it's 6 watts in the 1 kilowatt device and up to 3.3 in the other ones. No problem. Perfect. Right. I think that everybody will be needing to get back to their patients now, back to their busy clinics. Hopefully that was helpful for you. Like I say, any questions, please shout. Thanks, Rich, for trying to help. Sorry, I didn't set up the co-host facility beforehand. If I'd known, I would have done it. I will get a recording link out to everybody that'll be available for a limited period of time. So you can watch it back if you want to. Thank you so much for everybody who's come along today. I think this is the most people we've ever had on a webinar. It's been amazing. Have a good rest of the week and a good weekend when it comes.